Well, hey there, my name's Dr. Andrew Gorecki. For those of you that don't know me, I am a back pain specialist. People come to me when they're looking for help with their back pain or sciatica, and I help them, but not in the way that you might think. But before we get started today, if you like what I'm talking about in this video, and you're serious about finding a natural solution to your back pain or sciatica, I'd encourage you to visit myonlinesession.com. That's myonlinesession.com, where you can schedule a call with me and we can talk about your low back pain and sciatica and if a natural solution is there for you. So people come to me and they often ask me for a natural solution to their back pain and sciatica, and they want to avoid medications, injections, and surgery, but they're frustrated with the options that are out there because they are only masking the symptoms of pain and they're temporary. So they come to me and they want to find a solution, but they don't want to waste their time, their money, and their energy on ineffective options that only mask the symptoms. And yet, even though they're motivated to find a natural solution, they're frustrated because all the things they've been given in the traditional health system have only masked the symptoms. So who wouldn't be frustrated by that, right? Those short-term Band-Aids, when really what we want to find is a long-term solution. And so when I meet somebody that comes to me for help and they're telling me that story, which is very common, I tell them one thing always works, and that is really to think outside the box and recognize that low back pain is not the low back's fault. It's actually the areas above and below that aren't moving properly that are causing stress in the lower back. No matter what your type of back pain is, if you focus on the areas above and below, you'll find a natural solution and you'll return to moving again without pain. So if you're serious about finding a natural solution to your back pain, I'd encourage you to visit myonlinesession.com. And you can talk with me and we'll find a natural solution for you. And in the rest of this video, I'm going to show you some hopefully useful information that'll help you get along the path, get down the path of natural healing today so you can get started. So I hope you enjoy. Welcome back. My name is Dr. Andrew Gorecki, owner of Superior Physical Therapy, and today we're talking about the most common type of low back pain referred to as stenosis. Stenosis is also known by other names, most commonly arthritis, and the big scary one is degenerative disc disease. So I'm going to talk to you a little bit about what it means. So it's the Latin word for narrowing, and really what it's talking about is a hole on each joint, each segment of the spine. There's a hole where the nerve comes out, and that hole starts to get narrow as we age. It is a very common thing to happen when we age. In fact, there's a recent study that was done that shows that 80% of people over the age of 60 years old have signs of stenosis in their spine, and the tricky thing here is they have no pain in that study. So we'll get back to that later in the show. So stenosis means narrowing. The nerve is coming out, and what I like to describe this as is it's important to recognize that when you look at two bony segments in the spine, the nerve comes out of the hole, but that hole is not a fixed diameter hole. It's actually two half circles. One half circle from the joint or the bone above and one half circle from the bone below. And so the reason I think that's important is because when people get told they have stenosis, they think that there's nothing you can do about it. And in reality, that hole is narrowing because the bones are getting older, but that hole is also moving all the time when you're moving. So for example, there's three ways we can make that hole smaller just by moving, no matter what age we are. So number one movement that makes the hole smaller is bending backwards. So that will make the hole get smaller. And the reverse on that is bending forward makes the hole bigger. So even if you have stenosis in your spine and you're aging, we know that we can make the hole bigger by simply bending forward. It's why oftentimes people that are older that are having back pain that's related to arthritis, you'll see them walking in the grocery store, leaning on the grocery cart, or having to bend forward because the pain is so bad, or actually just sit down. Sitting down causes the hole to open up as well. There's two other ways we can make the hole smaller. If it's my left side, if I lean to the left, that also makes the hole smaller. Now, if I lean to the right, it makes it bigger, so that's nice. And then finally, if it's my left side, when I turn to the left, that actually makes the hole bigger, open up, and when I turn to the right, it closes it down. So the point is that hole is dynamic. Stenosis does mean narrowing, but it's natural. As we age, our spine is getting older, just like our skin. It's almost as common as wrinkles on the skin. I have a really easy test that I can give you right now that'll help you understand whether or not your back pain is related to stenosis. It's very easy. It's actually 4 questions. If you answer all yes to these 4 questions, there's a 97% chance that you actually have stenosis as the type of back pain. Now, later in the show, we're going to talk about how the type is not the same as the cause. They're totally different. The type is the diagnosis, it's the description, but it's not actually the cause. So we're going to get to that later in the show. So here's the 4 questions. Are you over the age of 50? That's number 1. So do you have 50 birthday candles on your birthday cake? Number 2 is, do you have pain in your back when you're standing? Do you have pain in your back when you're walking is number 3. And then finally, does that pain go away when you sit down? If you answer yes to all 4 of those questions, research and science indicates that there's a 97% chance that that's actually the type of back pain. But the good news is, like I mentioned before, 80% of people that are over the age of 60 years old have been shown to have arthritis in the spine, but they have no pain in one study that I'm referencing. So there's a lot of hope, there's a lot of good news. Stenosis is actually a natural aging process. Just because you have arthritis in your spine doesn't mean that there's no hope.